Normalizing assessment to facilitate peak of verbal behavior therapy. Major professor is Dr. Mark R. Dixon. The research was done to determine age-appropriate development on peak assessment so as to compare to persons with disabilities. 51 typically developing children between ages 2 and 18 were assessed. Peak direct training assessment model brought by novel implementers, parents, caregivers, teachers, administrators. Results suggest that there was no correlation between peak total scores and sex with R-square of 0.49. Total peak by age group with a one-way ANOVA was done, suggesting that the differences between ages in terms of peak total score was significant. Introduction. Early interventions identifies language delays, as seen through the research of and studies of Duran and Crimmins, 1987, McGuell, Carr, and Michael, 2002, Sundberg and Partington, 1998. Researchers have evidence that a lack of early intervention services for children with language delays is associated with increased risk for difficulties in other adaptive areas, such as social skills and cognitive learning. In addition, many problem behaviors, including that self-injurious behavior, aggression, noncompliance, destructive behaviors, are identified with delays in communication, as seen with the study of Carr and Duran, 1985. Early intervention for language delays may prevent extensive treatments that involve replacing maladaptive behaviors with functional communication skills. Fisher et al., 1992, Kelly, Lerman, Van Camp, 2002, Groh and Kodak, 2010. An essential component of intensive early intervention for children with autism and other developmental disabilities appears to be the evaluation of techniques that improve language development. As we go on to Skinner of 1957, his aim was to bring prediction and control for human communications to improve socially his significant behavior through his verbal behavior publication. ABA is the science in which tactics derived from the principles of behavior are applied to improve socially significant behavior and experimentation used to identify the variables responsible for behavior changes. Language acquisition, social interaction, academics, intelligence, understanding, thinking, problem solving, knowledge, perception, history, science, politics, and religion are all directly relevant to verbal behavior. In addition, human problems such as autism, learning disabilities, illiteracy, antisocial behavior, marital conflicts, aggression, and wars involve verbal behavior. Verbal behavior plays a central role in major aspects of a person's life, laws, conventions, and activities of society. B.F. Skinner, in 1957 writings, said the effects of an action determine its future probability. An example given was walking in a forest. A hungry person sees a brightly colored globular object hanging from a tree. It is picked and tastes good. Then on another day, sighting another similar object, he immediately picks it and eats it. Actions and consequences designate an operant. The utility of Skinner's concepts of autoclitics and most higher thinking skills, as done through research of Kelly et al., 2007, Tesori and Greer, 2003, and Drash et al., 1999, emphasized that and showed that almost all of them examined just 4 verbal operants. Dixon, 2007, also noted that the data were heavily biased toward autism or mental retardation populations. Going on to Hayes et al. In 2001, it's a post-Skinner account of human language and cognition with their book, RFT, Relational Frame Theory. This theory accounts for human language and cognition through derived stimulus relations. It is what minds are full of, speaking with meaning and listening with understanding. Hayes defined relational frame theory as a behavior analytic approach to human language and cognition. RFT brings a technology and conceptual system to promote language effective based on a vast body of empirical research. Going on to Reinfeld and Barnholmes, 2009, they present us and have developed strategies for teaching language with applications built from the Sidman's discovery of emergent relations and Hayes' conceptualization of relational frame theory. In this text, the authors detail a series of instructional strategies based on the decades of basic and applied research from derived stimulus relations and their application to persons with autism. Their book focused on areas such as prerequisite skills, intermediate skills such as naming, reading, spelling, and requesting more complex skills. Most recently, Dixon, 2014, released his first book of Peak. It has been written as an assessment and treatment protocol for persons with autism, designed to teach a wide variety of skills across 4 different learning modules: direct training, generalization, equivalence, and transformation of function. The first direct training module uses a discrete trial training approach which utilizes reinforcement, prompts, and error correction for each response made during the delivery of the therapy. This research is focused upon that module. Other ABA similar products, such as the VG Map by Sundberg, 2013, and the Abels Partington, 2006, quickly established itself as a reliable and valid curricula with assessment brought through empirical studies and evidence-based practice. Raleigh, Belize, Dixon, 2014. The study supported previous studies, Dixon et al., on the reliability of the peak assessment and supported the internal consistency and underlying framework of peak. Methods. The present study examined a normative sample of typical developing children accessed on the Peak Direct Training module. Can that data have any correlation with chronological age as presented in the research? Participants and settings: 51 children, 22 females, 29 males, ranged in age from 2 to 18. Reporters: head teachers, school administration, and parents. Completed assessments as an indirect assessment. There were 14 adult assessors. Peak has 184 skills in which to answer yes or no or unknown on the 184 different skill lines. Assessment includes a brief description of each skill. Additional demographic data such as current grade level of each child and self-reported history of known disabilities was requested. Methods continued. The 184 peak developmental skills were the verbal skills in the first module. Each item corresponds directly to peak curriculum. Items determined to be absent in participants' repertoire can be taught using the peak curriculum. 14 subsets assessed in the first modular, examples being a 2-step motor action, vocal imitations, labeling of sensory feelings, Addition, subtraction, guessing future, and telling a joke are some skills in the last set. Inter-rater agreement. 20 assessments completed for the 4 to 5-year-olds in an educational setting. Teachers and school administrators, parents, or caregivers. Observers obtain similar data from different children and assess independently. Definition of target behavior was clear and unambiguous. Measurement code and system not difficult to assess either. The analysis of relationships among scores on various assessments, analysis of convergent validity determine extent to which peak assessment can be accurately utilized. Results in our figure 1 suggest direct relationship between chronological age and total peak score on assessment. Acquired skills can be seen reflected in each age group. Versus Dixon 2014, the age failed to demonstrate a significant relations with children diagnosed with disabilities. On the table that was generated, you see each of the 185 skills presented in peak in groups of 2 years, 2 to 3, 4 to 5, 6 to 7, 8, 9, 10 plus. And as you peruse those scores, you'll see quickly the development of children. The statistical analysis was brought through a scatter plot of scores between the ages of 2 and 18. Total peak of 184 skills assessed compared to the age. If you look along the bottom, very quickly you recognize that at approximately 8-9 years of age, they have mastered the peak skills. Statistical analysis. Visual analysis, positive correlation between age and peak. Age increases, so do the peak scores of the normative group. Ceiling effect, age of 8 to 9, scoring 184. Variance in scores seem to diminish as kids get older. Discussion. The psychometric properties of the peak direct training module. Skunas and kurtosis suggest a sound assessment of children's behavior repertoire. Normative data may serve advantageous for comparison with individuals with disabilities. Peak can indicate specific items that individuals lack relative to their atypically developing peers. Educators may align the clients that they serve with the normative cognitive skills. Small sample sizes present a high internal validity. Limitations. Continued supported data-driven research is needed. Small sample sizes reduce external validity of results and does not allow for standardization of peak total score. Standardization might be unnecessary as it is criterion reference assessment. Homogeneity of the sample reduces the external validity of findings in exchange for higher internal validity. Trained reporters compared to caregivers or untrained assessors might also bring different results through their terminology of the information, and their own perspectives and observations might prove different. Future considerations. Normalized assessments needed for future modules developed by peak to identify similarities and differences between populations of normal developing children to those identified with disabilities. Hayes in 2004 states the field of behavior analysis is progressing since the early operant experiments with basic organisms. However, the field must continue to develop in order to understand the complex human behavior, re-examine and change some familiar fundamental concepts and analytical tools as necessary, and progress progress yet to be made or discovered, Peake suggests such a window through language and cognition can be better understood. The references are as revealed. Thank you.